Coming up on this episode.
That's one of my main drivers for what I do now too, is to help nurses like really alchemize this because it's hard on your body.
Welcome to What the Healthcare Podcast. I'm your host, Emily, and today I am joined by Andrea. Andrea is an RN who left left the healthcare system. How many years ago now, Andrea?
It's been 15 years.
Wow, 15 years. I can't wait to get
Mhm.
into what the system looked like then versus what it is now. So let's start by tell us a little bit about yourself.
So now that I've left the system, I am a coach. I don't know if a lot of your listeners may not have heard of shadow work, but I am a shadow work coach, and that's more about your mental wellness than anything. Like I was a holistic nutritionist for a while and a yoga teacher, but I really clung to the mental aspect or the emotional aspect of our wellness because it all kind of goes together, the mind, body, spirit connection. So that's where I've landed, and I love it.
Yeah, that's awesome. So, actually, I recently learned about shadow work. I did not know anything about it prior to being in healthcare. It wasn't until I left the
Yeah.
industry that I started to learn about that and learn the connections of like our mental health and our physical health and how essentially if you don't work on these things and work through these emotions and bottle up your emotions like many of us do, it'll come out some way, physically, mentally. So I
Yeah.
guess let's go into that a little bit. What give us kind of an explanation of what shadow work is and what led you to that type of work?
So it was really like I have to back way up with this one because when I was in my nursing career, I was so miserable and so burnt out. I have a chronic illness, type 1 diabetes. And it was really through spirituality. Like I really went through a spiritual awakening, if you will, through religion first. And then it was because I was raised Southern Baptist. And then um, I had this I went to this energy worker, and my experience with that, I could not unsee what I experienced or unexperience what I had experienced. And that was really what led me down this rabbit hole of finding other alternative ways to help us heal ourselves basically. So I was really in this place of like I want to feel empowered because I had felt so disempowered from the healthcare system as a patient and as a nurse, and it was both sides. So I couldn't unsee and how like food helped us really like change our moods and things like that. So I don't know, I just gravitated to that part, and I'm just really blessed. I feel like that I've landed here.
So how far in did you get into healthcare to your career till you realized the system is setting us all up for failure?
Well, it was probably 6 months in, if I'm really honest.
Oh, wow.
Yeah, I started off on med surge, and immediately they threw me in, like 6 months out, they threw me into being charge nurse one night because I worked night shift, 7P to 7A. And I was the only RN on a 36 patient floor with two LPNs, great LPN. Those LPNs saved my life. I love them. But we had all these med surg patients that had IV push medication, and I was the only one that could do it. And so I was like, I just got my license and now I'm going to lose it. But I will say, then when I became nursing supervisor and basically a director position as well in peri-op, is when I really learned that it was a business that was a nasty business, just like I heard you say. And my eyes were really open because I was working in peri-op. And I remember my VP of nursing, we have our weekly meetings, and I remember sitting at her desk, and she was like, we have to, like, we are so under budget. Like, our productivity is terrible. And I remember I looked at her dead in the eyes and I said, so what are we supposed to do? Go get baseball bats and like break people's legs so they need surgery? Like, what? How do you make
Fill
people
those
need
beds.
surgery, right? And fill those surgical suites. Like, it made no sense no compute. There was no compute at that point. I was like, okay. I
So let me ask you this: if you kind of, because like I feel stupid even saying this, but I mean it took me 20 years to realize that the system is a business and a failing one, and at least one, maybe not failing financially, but failing patients. And I
Oh
think,
yeah.
it took me going over, similar to you, getting over to that business side, the administrative side, to really see things. And so once I noticed it, I was like, I cannot stay in this. I got to get out of this. I cannot be part of this industry anymore. So what made you stay? Because
Money,
you kind of noticed it pretty
fear,
early on. Yeah.
fear of leaving, fear of being an outcast, fear, just I was so my identity was so wrapped up in nurse. Like it wasn't until the very end that I felt betrayed by the nursing profession itself. But it was fear, like because I was a single mom. I mean, fear of like the loss of money, honestly. But I knew too that I was a damn good nurse and a damn good leader. Honestly, I can say that. And yeah, I mean, it was just I think looking back and doing all this shadow work, I will say the loss of identity too. That now I can see, like, you know, I was so tied to that identity of being a healer or helper in the world. But there's another way to do it. I'm just going to go ahead and say that. Spoiler alert.
Well, I mean, that's a really good point, because I know for myself, it took me, I mean, first of all, you leave the system and you go through this array of emotions,
Yeah,
anger, frustration,
grief.
guilt. I mean, I felt guilt for a long time. Like I had been part of this system
I
that
know.
is not helping people. We're hurting people. And oh my gosh, like what was I thinking? So I really beat myself up for that for quite a while.
I
But letting
understand.
go of that identity, I'm a nurse. You don't hear nurses saying, or doctors, I work as a doctor, I work as a nurse. I'm a nurse, I'm a doctor. So
Right.
separating that is, I mean, that was a wild ride in itself.
I know. Oh my gosh. So in shadow work, this is what I realized is this term inappropriate guilt. Right, and I don't know, this may help you or some listeners that feel this guilt too, is that I didn't realize I was carrying around this inappropriate guilt of things that little Andrea couldn't change it by herself. Little Andrea tried to save people that were dying. I could tell you multitude of stories, and I'm sure you have them too, of people that needlessly passed. And I felt like, ugh, see, I still get teared up. Like I felt so guilty, but there was nothing I could have done, honestly. And like ultimately, there was nothing I could have done. And so I carried that inappropriate guilt around, and I say I've released it, but it still makes me like tear up, But it does,
Yeah.
my body doesn't hold on to that anymore as much as it was just a huge like trigger that I've had to
Needless
as a,
loss of
yeah.
lives. Yeah. Well, and you were in surgery, right? So,
Yeah, this was on med surge though when this happened.
oh, well, even so, I mean, I'm sure, both areas,
Oh yeah,
they're,
I mean,
I mean, the malpractice rate itself, and I don't know the specific numbers to each specialty, but I do know in surgical specialties, it's pretty high.
yeah,
So
yeah,
I can imagine.
yeah.
So you left the system, and what brought you to shadow work? Was it something specific in your life? Like, were you looking to heal, or what was
Yeah,
it that
yeah,
got you
actually
there?
I was looking to heal because when I was 15 I was diagnosed with type 1 diabetes, and going into this I kind of knew because my grandmother had it, but I went to the doctor, and literally this is what she said. I'll never forget this. This is where my medical trauma came from. She said, "Andrea, you're not going to live a long life. Don't have babies. And oh, if you do, you need to have them really young." She just kept telling me everything I can't do. I can't. You're not going to be able to do this. You're not going to be able to do this. And that's all I heard. And so I really wanted to undo that. And I knew that it was trauma, right? And medical trauma. And I'm sure there's so many people walking around with medical trauma that I like lost a piece of myself in that, and every decision that I made forward from that diagnosis was made in fear, right? Like it was my decision making bus, the trauma from that right there. And it I knew that I had to untangle it, and I knew the only way was to bring it, whatever was sitting there subconsciously even about that story, I needed to bring it to my conscious awareness and then move it through my body very somatically, because that's how I do it, and integrate all the parts of myself so that I wasn't fragmented anymore. And we get so fragmented in the healthcare system, period. I mean, we just get fragmented in so many different ways.
We do.
Yeah. Yeah.
We carry a lot of what we see. We internalize it. I mean, I think.
I do too, especially as workers. Because think about this, Emily. Like this is a passion of mine to talk about this. Is, let's say a patient, I almost said a client, a patient dies. Who processes that with you? Nobody. You just go to the bathroom and cry for a second, and you get right back out there. It's terrible what it does to your psyche. It's terrible what it does to your psyche.
Well, you wonder why you don't wonder, but the public may wonder why addiction is so high amongst nurses. Yeah. Nurses actually have their own NA and AA groups. I can't remember what they're called now. But yeah, there are groups specifically for nurses, like AA groups and NA groups. So that, I mean, so we don't have time to grieve and to process. And you know what else? It's like, I was talking to somebody about this the other day. We are now so used to seeing things on a screen that you swipe on by that really should be traumatizing. Like you can watch a car accident happen on social media and watch somebody being unalive, and then you scroll it and the next video is a kitten. And it's like, if that's a very good point. And if like we saw that live, it would take years to process that trauma. And so it kind of
like we've been desensitized.
Desensitization. Yes. Yeah. And so I relate that to nursing and to healthcare in general, you know, because it was the same thing. You didn't have time to process these things that you saw.
Right.
And maybe some of us didn't, you know, I mean, my gosh, the nurses and doctors who work in trauma, I cannot even fathom.
I know. That's a great point.
Because, yeah. So I kind of, you know, think that both are very similar, and we hold on to these things. We don't grieve, we don't process, and you know, a lot of us end up addicts, unfortunately.
It's so true, and it's just sad, you know, that we aren't treated with more respect and get the kind of healthcare, mental health, healthcare that we need to as nurses.
Yeah.
And that's really important. That's one of my main drivers for what I do now too, is to help nurses like really alchemize this, because it's hard on your body. Because our physical wellness, the emotional wellness will affect your physical wellness and vice versa. You know, it all goes together. It really does.
It does. We are in a constant state of fight or flight. If you think about it, you are in a constant, I don't care what area in healthcare you work in, you are in a constant state of fight or flight. You have no choice but to disassociate yourself.
You are hitting it on the, I mean, I know, because you know, but I'll tell you, when I quit, I slept for 2 weeks. My adrenals were so fried. I mean, literally, I was in adrenal fatigue, like, and I do still struggle with that. Now, honestly, but I slept for 2 weeks and that, what does that say? Like 2 weeks straight.
Yeah, I know the feeling. I mean, I feel like, and it's funny, I've been trying to get this podcast up and going for a couple years now, and every time I would make a little progress, it's like mentally I was going back to healthcare, and I just didn't want to do it. I was angry. I did not want anything to do with healthcare. I wanted out of that system, far away from it, and did not want to associate anymore. And then I kind of got past the anger phase, but still I would make a little progress. And it's like, I didn't want to go there mentally. My body did not want me to go back there. My brain
doesn't
did not
feel
want me
safe.
to go back there. because
No, and your and
exactly,
your
it did
your
not feel
mind
safe.
remembers. It's just like
Yep.
that book, the if you've ever heard of it, The Body Keeps the Score. So your mind was
Yes.
identifying, that story of like, oh, this is taking me back. It's almost like being in war. I mean, you could literally, it's not war, but
Yeah.
your body perceives it that way. Like
Yes.
you're constantly like, yeah,
It's
this. So
so true, and like I mean, I can't even talk about half of what I've experienced because I signed an NDA, and that was the stupidest thing I could have done because
wow,
now I'm stuck with it. I can't talk about it. So
wow.
that's very frustrating.
Oh
But
wow.
anyway, yeah, yeah, yeah.
I've
It was
never
not
heard of
very
somebody having
smart.
to sign an NDA, but
Well, it was there was some things going on in the practice that I was in that I pursued legally, and so I had no choice. I mean, I was really left with no choice. So it's
yeah.
unfortunate, but thinking back, I wish I wouldn't have done it. I wish I would have. I could have. I could have had the whole. I could have
Well,
had
you're
that
doing this, right?
entire
Like this
system
is the
shut down. I mean, it was.
right.
Yeah, this is
Oh
my
gosh.
outlet. I just I wish I could. I wish I
Yeah,
could talk a little bit more freely, but that's okay. At least I feel good
right.
about doing this. I feel good that I'm able to provide a platform for healthcare professionals and patients,
Mhm.
especially
Oh,
because
yeah.
they have been gaslit and gaslit and gaslit, and they deserve a space that is safe where they can share and
Hmm.
not experience that.
Oh yeah.
So
Because I've
let me,
experienced it on both sides. So I totally get that, and I love that you're doing this.
as a
First of
patient
all,
and a nurse, you mean, like
mhm. Oh
experience
yeah.
the gaslighting?
Well, I'm type 1 diabetic, so
Ah,
that's yeah.
okay. Enough said. Enough
So
said.
fun. Yeah, yeah. So fun. Yeah.
So, what do you feel like if you think back to when you were in healthcare?
Hmm.
Can you think of like maybe what were the first cautionary flags that raised an eyebrow that made you kind of see the system for what it is? What am I doing here? Kind of like, was there
Uh,
specifics that happened, or was it just a
yeah. I'll tell you one story, and this story still breaks my heart. It really does. I had a patient, and it was, I was doing my night shift, and I got her chart before I went to see her, and I looked at all the notes, and I was like, there's nothing here, because I had gotten a report, and I was like, nobody's done. Like, I think she probably needed a CT. I can't remember because this is like early on, on the med surge floor. And she was African American on Medicaid. Nobody had done anything for her.
oh my gosh.
Nothing. And she had a GI bleed. And so I went to her room because I was like, what? She'd been there for a week. Nothing had been done. Some labs, some
Oh my
labs.
gosh, a whole week.
She had a bedside commode there was blood everywhere in the room. So I'm like, how hemoglobin, a million thoughts racing through my brain. And I remember she was in so much pain. And this is one of those inappropriate guilt things that I was carrying around. And so I immediately called the doctor and was like putting in all these orders and had things lined up for her. So the night's going on, and I made her comfortable. I left her, and she was in one of the rooms for TB patients. So I don't know why she was in that room. I don't even know why I'm saying that out loud. But
It's
anyway, she was
okay.
like off in this corner, and so I go in there like midnight. She was fine. She was sleeping. So I was like, I'm going to let her sleep because she was just miserable. And so I didn't go back in there until like 5 o'clock in the morning. And she was just, she didn't call me. She needed help to get up to the bedside commode. Again, I go in there, there's blood everywhere, even more. And she was just like this in pain, and she's like, I was like, why didn't you call me? Like, I could have come and given you some more pain medicine. And so I called the ICU immediately because I knew, that nursing intuition. I
Uh
know
huh.
like
I do.
something bad is happening. And I remember we got her immediately to the ICU. I wheeled her down myself, and I remember our hands going like this. I can remember the moment. And she looked back at me and she said, "Am I going to be okay?" And I said, "Yeah, you're going to be okay. You're going to be okay." And maybe 30 minutes later, they called the code, and she passed. and she had her intestines basically had ruptured, and I just never forget it. And I carried so much guilt around that, but that was my first night having her. Nobody had done anything. She had been there for a week, and I'm the one that walked around with all the guilt of it, you know. And so I
Man.
it makes me so angry. And if you're reading between the lines, then you heard me say she was African American on Medicaid, and I really think that had a lot to do with it. I do.
Yep, I would agree with you. I think pain patients too are often ignored or mistreated. And honestly, I think a lot of that is the addiction that's in medicine because there are so many addicts themselves.
Yep.
And so they're assuming that everybody else is an addict. And so if a patient comes in and they're asking for pain meds,
Right.
well, because they know
What a
their own
projection.
personality and they're what a projection. What a
What a
projection.
projection, right?
And it's so sad. And you know, I'm for a while I was anti-Western medicine across the board. And I realize now there's a place. There's a place for it. There's a place for prescription medicine. I do not think it should be your first resort, you know, but you know, maybe for some people it does, whatever. But regardless,
right.
that patients do not deserve. So that woman, how old was she? Was she young?
She was probably in her late 30s, I want to say.
So laid in a hospital bed for an entire week, essentially bleeding out internally.
Bleeding out, yeah.
How in the world
I know.
did that get past? Because there's 3 shifts in a day, an entire week. How in the world?
Week. I was so angry. And this was early on. Like, this was early on. My early career was on med surg. I only stayed on med surg for about a year out of my 14 years of being a nurse. So I already knew. And see, and I did stay, right? Which could lead me to feeling more guilty, but I'm not going to feel guilty because, again, you know, I was a single mom, and you know, you always think like, wow, that can't be. Like, surely that can't be.
So that was the aha moment for you feel? Like that's when you kind of had that
I was like,
realization that
wow, yeah, I put those two things together. And that's an assumption, of course, but I think it's a safe assumption.
Yeah, I think so too. I mean, I have worked in 3 different states, hospitals, rural hospitals. I've worked in one of the top 10 pediatric hospitals in the country. I've worked in private practices. And I will say private practice, in my experience, was the best that I felt when it came to patients because, you know, they weren't, the doctors were not governed by administrators
by the
quite as
hospital.
much. But yeah, but across the board, I mean, there are issues. I think people generally go into the system because they're good people and they want to help, and they don't realize how bad it is. Doctors, nurses, all of us, right? We're trying to do good.
Exactly.
But you realize that, I mean, I know for myself, when I got to that administrative side, I was the only person. I was managing 3 different specialties, surgical specialties. I was the only person on my team that had clinical experience. And so every decision that was made came from people with business degrees, and it came from a financial perspective. And it's like nobody was thinking about the patients. Patients first, staff second, money comes last. But you just, that's not what their expertise is in. They don't know. They don't understand that the decisions that they are making have the effects that they do on patient care. And then you also realize that insurance companies are running the show, pharmaceutical companies are running the show. So, you know, and at the end of the day, doctors bear the brunt, in my opinion. I mean, they're the face. And so, you know, it's not the doctors that are making that money. It's not the doctors that are, it's the hospitals, it's the system, it's the administrators.
And the insurance companies. Oh my God,
And
I could have.
the insurance companies,
That's a
forget
whole
about it.
nother. Oh, that's a whole nother beast system.
Yeah, it is.
I don't know why I got this tickle in my throat.
It's okay. Take your
I
time.
apologize. Um,
It's okay.
but yeah, these are really big conversations, and I think that people. Well, I think people are starting to wake up to like, what? Things aren't right here. And I think they have been for a while. However, there are, I mean, imagine how many people there are that don't know, they don't get this because they haven't had to experience being in, being in the system or whatever. But it is, especially navigating with a chronic illness, like out on the patient side for myself, has been the most frustrating 32 years of my life with type 1
Aw.
diabetes. Yeah. But I mean, thank goodness for my
I
tools.
Well, I actually that was going to be my next question. So, from a nursing perspective, did you feel like you weren't being given the tools to keep patients stable and healthy? Like, do you feel like the support and the tools were missing?
Well, absolutely they were missing. Like there was never enough time. There was never enough resources. There were blood pressure machines. I mean, we're always fighting for, wheelchairs. Like I mean, it was just and then the health part. Oh, okay. So I worked in the PACU for years, the post recovery or post anesthesia recovery unit. And I mean, you're handing these people sugary popsicles and sugary jello to help heal a wound. I'm like, well, that's counterintuitive. Very, that's not going to help heal, right? So I'm like, we need like herbal popsicles and like all the like things that are so absolutely a no about keeping patients healthy. Could we keep them stable? Well, yeah, after we were fighting over the, all the supplies that we needed. But that was a thing, and not enough staff and having like really critical people that were a lot sicker. They needed to be in the ICU. They didn't need to be on like a med surge floor. Yeah.
Yeah,
Like the
well,
patient I just
speaking
told
of,
you about was one. Yeah.
yeah. Oh, yeah, she needed to be on ice. She needed care. Period.
She needed some care, period.
She
Exactly.
needed care, period.
Oh,
Going back to like what we're giving patients who are trying to heal, and yes, to your point, we're giving them sugary popsicles and not adequate nutrition. I will never forget a patient that came in. So I worked in patient pediatrics for about 10 years, and we were in a rural hospital, so many times we got the overflow from med surge. And
yeah.
we had a patient who she had fallen at home and broke her leg, and she had been drunk when she fell. And so had an order that with every meal came a can of beer. And she didn't understand it. And I am like, I don't get it. Why are we giving this lady a can of beer? Well, because they assumed she was an alcoholic. And because she wasn't there for that problem, we're just going to continue to make sure she doesn't go through withdrawal by giving her that beer. It was wild to me. Like,
That is
that
wild.
was,
But
isn't that
but
wild?
yeah, it is. But you know what? To that point, because God, this is crazy. So I had a patient too that he didn't tell me in his assessment when I was admitting him to the hospital that he drank every day. He left that part out. He ended up going into DTS and like ripped the IV out. Was halfway down the highway before the police found him and got him back, and he was totally he had just but he's a normal guy. I mean, just you know, but in a way, I think he needed that beer to not go into TT. I mean, I don't know. I don't
Well,
know. He could have maybe
probably.
gotten some anti-anxiety. I don't know. I don't know. But
Yeah, he
it's
probably did, but isn't there a better way to like, maybe address that? Maybe, if it's a problem, address the problem. And I do understand there's not enough time in a day and the patient's there for a specific reason, but it highlights that we're not treating the patient as a whole person. We're treating the symptom
exactly,
or the issue that they're coming in for. And so that's
exactly.
what was so baffling to me is, so we're going to fix this lady's leg and she wasn't an alcoholic. Like, she was stunned that this was happening. She's like, I just got
Oh,
drunk
wow.
and, I and fell and broke my leg, like, I don't, but it's like, and even so, say she was an alcoholic. So we're going to bring her in as an alcoholic, fix her leg, and then send her out as an alcoholic. It just
I know,
didn't
I
make
know.
sense to
It
me.
it doesn't. It's like, what? But I see what you're saying because she was that drunk this one time at band camp. I see what you're saying.
Right.
Wow.
Yeah. It was bizarre.
That is
Um,
bizarre. I see.
yeah. Like, what about school? What about nursing school? Like, how, I mean, I know it's kind of like a whirlwind. You go through it, and even so, like, you go through school and you come out and it's a completely different world. But
Oh, it
when
is.
you were,
Yeah.
yeah, like when you were going through the program, what was your thought process? Were you excited? Like,
I
did you
loved
start to
it.
see
I
anything then?
loved nursing school. No, I didn't. I was full, like, I had to have straight A's. Like, I was so excited about nursing school and I really rocked it. And I was so excited about my life. And I think this is where, in the end, I started feeling betrayed by the nursing profession. And we could get more into that later, but, or if you want to go there, but,
Yeah,
no,
definitely.
in nursing school, no, I loved it. I loved, like, they made us put on briefs on each other so that as if we needed to learn empathy, because I think all nurses that go into nursing are empaths, but
Yeah.
I remember putting on that adult diaper and practicing and thinking, wow, this is what it feels like to lose your dignity. But no, we don't no, I was just such a really good nurse. I really was, like, but I got told a lot that I cared too much. Just put it that way. You
Oh,
care too much. You care too much.
I
You
don't know
care
how you
too
could ever
much.
care too much.
Me either. I'm like, what are
Well,
you?
what about,
What?
I do agree with you. Like, I had fun in nursing school, and I remember that doing that too. I remember putting the briefs on each other. I remember practicing blood draws on each other, and I remember that
Yeah.
feeling of camaraderie.
Oh
But
yeah.
then you get out to the field, and it's like the nurses eat their young. What? Why? Like, did you experience that too?
Yes. Oh my God, yes. And I remember, I did in many ways, and I did it because I ended up. It's crazy. One of my first preceptors out of school was actually, she ended up becoming one of my employees much later, and so that was really cool. But so I ended up getting really good nurse preceptors. And when I got out of the preceptor part, and they're like kicking you out, like, okay, you're on your own. That's when like, I would ask for help. They would just see me struggling, and no, nope. There was this one LPN though. Her name was Jenny, and Jenny was like my shero, and she really,
Aw.
like, took care of me. Yeah, because I was young compared to everybody else, at that time, and no, you could just see the toxicity, like, talk
Yeah,
about nurses
why
eating their
though?
young. I think that we're just fried. We're burnt out, and there's compassion fatigue. There's people just genuinely walking around, because I'm going to take this back to shadow, right? We don't know what these nurses are experiencing in their homes. We don't know what they're experiencing anywhere else, but they're expected to show up to work and take care of these other people with so much compassion. I think that nurses ultimately need a lot of tender, compassionate care. And that, to your point, that may be why they lash out. That's where they get to lash out, is at work. And they see so
At
much and
each other.
experience so much trauma. Oh yes, at each other. And that it's just like this bickering back and forth. And even sometimes there's this, like, power struggle. I know more than you do. I know more than you. And it's just like, well, can we not just work together? Because isn't that what ultimately, like, teamwork is and what we're supposed to do? So
Mm-hmm.
that part I could just never understand. I don't know if I ever will, besides what I just said
Mm-hmm.
about it. And it being, people, nurses especially. I mean, let's think about the trauma and addiction. They go together. Those go together.
Mm-hmm. Mm-hmm.
And
Yes, they
they have
do.
been so traumatized and the compassion fatigue, like they're supposed to just, even when, let's be real, patients' families can treat you like dirt, garbage, and we just have to stand there and take it, which that's our job. And also, that builds up on your psyche and your emotional wellness too.
Mm-hmm.
When some things are out of your hands, literally.
Yeah. I think so too. I think we all have a Jeannie, by the way. I had a Donna, and
Did you?
she trained me. Yeah. She was an LPN
Oh,
who
love it.
was there for like 30 years. Actually, the hospital at one point went to RN only and told her, she was in her 60s at this point, and told her, you either go back to nursing school, get your RN, or you got to find another job. And she was devastated. And
That was
I know,
happening
like,
when I left. Mm-hmm.
yeah, that was well, and then they all went back anyway because they
I
realized
know.
that it's not cost effective.
It,
LPNs are yeah, and they're
it
valuable.
is not cost effective. And your experience,
Yeah, but
I'm
I
sorry.
had one of those too. I think no, you're fine. There's a lot to talk about, so we want to get into all of it. But I think we all. I'm so
All of
thankful
you.
for her because there is a lot. Because she really
There
trained me.
is.
There, I know it is such a large subject, and I did not know until I
I
started posting on
know.
social media that there is a general unawareness when it comes to the public. They do not
Mhm.
know, for the most part, why the system is failing or how bad it really is, and
I know.
we gotta. It's
And you don't
time
want to scare
to shed light on
people,
it. I know
right?
you don't.
But you do need. I mean, y'all, if we're all looking for the truth, then here
Yeah.
we go.
Yes.
And it's when we
Yes,
all
I
start to
agree.
share our experiences, and that's the only way to get to the truth,
Hmm.
my
What
perspective,
do you
anyway.
think has led to this like massive awakening? Because I feel like in the past few years we've gone through. I mean, many nurses left, doctors too exited the system.
Well,
Like
I
a
think
one, like
COVID
what do
really.
you?
I think
Yeah,
COVID took a highlighter pen and went. Whew, you see what that just? You see what just happened? And all the like talking out of both sides of the mouth by Dr. Fauci. I'm just going to go ahead and say it.
yeah, do
Um,
it.
oh, there's lots I could say about all of that stuff, but I'm like, do I answer this in a woo way or like from a higher perspective, or like,
Mm,
mm, I think that people started waking up from their own experiences, like to your point. I know you said the gaslighting, and then honestly, I think that TikTok, I'm not kidding, like there has been this massive shift in consciousness and the awareness around when we get to tell our stories, that's when we get to hear the truth. And I think
mm,
that more people, as they've opened up, they're like, oh, this isn't just a kids app anymore. This is literally where you can go. Now, I don't know about now because I'm not seeing that so much now. It's like, but it was this platform where you could just find people's stories and hear because of that algorithm. That's how you find people that are similar or have had the same kind of experience as you. And I think that fascinates me. And I think that that's what's led to this awakening, plus COVID on top of that. And yeah,
yeah,
that
I agree with you on that. If there's one good thing that's come out of this app, TikTok, it
mhm,
has brought many like-minded people together. It's given us a platform to share. And I will say, I experienced a lot of censorship the first year I was on,
me too.
and I sometimes do now, not quite as much. You can definitely see the algorithms are changing, but the censorship was the most frustrating thing that I had to deal
Hmm.
with, and it would often push me off. I'd like, I can't
Yeah,
take this. I don't want to be. I was silenced for 25 years. I will not be silenced
right. It's like
anymore.
I'm tired of this being around my
Yeah.
neck. Hmm. Hmm.
Correct. And again, I mean, that's a lot of what led to this podcast too, is just, creating a platform where we can share freely.
Yeah,
Um,
yeah.
but I
I
do
love
like
it.
that it's brought many of us together.
Absolutely. And
So,
then and like I said, COVID too. That people are like, "What? This makes no
yeah,
sense."
let's talk about COVID. Let's talk about it. So,
Let's go there. Let's go there.
yeah, let's go there. There's a lot to talk about with COVID. So,
Mhm.
you we're not in the system during COVID, obviously, but
No, and I wanted to go
watching,
back so bad,
did
but
you? Yeah.
I
Well,
did and I
watching
didn't.
it from,
I mean,
yeah, when you're watching it from the outside, being a nurse, like what was, and especially like watching the changes daily, and what
mhm.
these, like what Dr. Fauci was advising, like what were your thoughts watching all of this unravel?
Well, I have a lot of nurse friends. My sister's a nurse. My stepmom's a nurse. And one of my best friends was a nurse because I'm in South Carolina. She was all the way in LA. So she was working at UCLA in the ICU. And so I had a lot of background, like even nurses locally here. I mean, because they were calling me because they were needing help with some trauma, and some
Mm-hmm.
processing. And so it was, I saw a divide in nurses that some people totally believed everything that was put out in front of them, and some people didn't. And I have friends on both. So, I mean, um,
Mm-hmm.
but watching this from behind, my nurse brain kept saying, "What in the hell is going on with this vaccine that hasn't been through the proper channels of research? The long-term effects, do we know? I mean, like how do you just but also I know of some corruption in some like even local research facilities because my stepmom worked in one and she told me how numbers were fudged a lot in research.
Mm-hmm.
And that already had blown my mind. And so that was playing in my mind too. And just like all this mask stuff, like that's not what we learned in school. Like that what it, okay, so but he's saying this today and he's saying something differently. And I'm just like, they are confusing the hell out of the public and scaring the out of the public. I don't know if we can cuss, so I'm like trying not
Yeah,
to, but I get
you
really
can. Yep.
passionate about this.
Yeah.
Okay.
You.
And
Yeah. Feel free.
yeah, I just was like, what the actual F is happening here? Because, in there were two parts of me. My diabetic part, type 1 diabetic part, that's like, oh my God, if I listen to the media, I'm gonna die. I'm gonna die. This is gonna kill me. Okay, this is what's gonna take me out is COVID. And then my intuition said, this is bullshit. All of it.
Mm-hmm.
Hmm.
Mine did too.
Hmm. Hmm. All of it.
Yeah. Uh-huh.
Hmm.
What do you think? What do you think the bigger picture is? Like what? Like I have my thoughts on what was really behind this. Like what are your thoughts? What was the intention?
The intention?
Yeah.
That's a great question. I mean, what did they want to decrease the population? Like what? Like is this population control? Like literally.
Mm-hmm.
And
Mm-hmm.
it's yeah, I guess that's literally the only thing that I could think would be the reason
Mm-hmm.
right now in this
Mm-hmm.
moment. Because I've sat here and thought about this for years now. Um, and there's all kinds of conspiracy theories, about like Ukrainian labs, like it was leaked from a Ukrainian lab, and um, I girl,
I know. Well, it's such a big rabbit hole. Like, I always go
it
back to it
is.
being politicized. Like, I feel like they wanted Trump out of office.
Oh yeah,
And,
yep.
I think that I think, I mean, that's kind of where I always go.
Mhm.
But there, I do also think there is probably more to it than that. And maybe, Depop is part of that. It's such a big rabbit hole. Like, and I don't,
It is.
and
It
and I
is.
believe, and I want people to understand, it was a very real
Oh,
virus, and
absolutely. Absolutely. Yes.
um, but
I
it
mean,
was
people die like so
correct.
many people
Yes.
died from this. Like, let's be real. Like the the body bags and
Yeah,
all that kind of like that was real and people really did die. I do not,
correct.
I'm so glad you said that because I would
Yeah,
never want to diminish the
yeah,
hurt and the pain and the loss and the grief that people experience through that.
yes.
So thank you for bringing me back to that.
Of course. But it
Mm.
was, in my opinion, mishandled.
Oh yeah.
And I think that there was definitely opportunity for financial gain in a lot of the decisions that were being made. And, you
Mm-hmm.
know,
Mm-hmm.
from a nursing standpoint, like you look at all of it and how, and just like the, like it just made no sense the
It made
way.
no sense.
Yeah. And it was so easily, when we went into that state of emergency, well, you can diagnose anybody who comes in with symptoms. Well, how are you going to differentiate?
Exactly.
You know what I mean? So
Oh, and
it's
what happened to the flu? Like there's
right.
so many questions.
Yeah.
Like it's just it's like oh, I don't know. Yeah, this is a really big rabbit hole, and I hope that we get to the truth of really what did happen.
Yeah. I don't know that we ever will, but
I know.
I mean, I hope for the same.
And
It's
even like
definitely
with the vaccine, like can we get the truth about that? With like
money, 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 money.
oh, big pharma made
Yes.
lots of money.
Right. And they created a huge supply. I think that they thought more people were gonna line up willingly, and when they didn't, they created that mandate, and I think it backfired, big time.
I do
Um,
too. I do
you
too. And
know,
my sister was completely ready to leave. Like she was like,
mm,
I'm okay. I'm out. And she got a religious because she really is a religious that was against her. Anyway, so she got the religious exemption, and I'm just so glad. I feel for
yeah,
those that had to make that choice
mm-hmm.
that were actually put in that position. I really do.
Yeah, I do too. And for the ones that experienced no side effects, I mean, great. I'm happy for you,
Thank
but there are so many
goodness.
people that have, and
And
talk about gaslighting.
right? And I'm sorry, but they pull things off the market after one person dies.
Right?
What happened to that when this vaccine came out? And
Well,
all the heart inflammation and all what in what world I've been asking myself a lot of these
mhm.
questions. In what world do we live in right now where it is okay to do X, Y, and Z things?
Yeah, well, I think it goes back to um, the lack of liability that big pharma has to carry. You can't sue them. So,
I hope that
um,
changes with what's coming. I
oh, I
really
hope
do.
so too. I tell you what, I have hope for the first time ever that we're going to see some positive change.
Me too. Me too. I
Yeah,
really feel that. And especially with, this administration and who they've picked to like come over into the FDA, the CDC. Like I'm
same.
just like, what? Okay.
I know.
Like
I have hope.
I do too.
And I used to
Talk
think there
about
was
doing
no,
healthcare differently.
yeah. I used to think there was no changing the system, and I still don't know that there is necessarily. There's so, well, I guess there is, but there's so much money behind it,
Yeah.
and it's like government, the food industry, the pharmaceutical industry, the healthcare industry. It's an entity that is kind of bundled into one. They all work together, and it's become so financially driven. But there's so much money backing it that I just thought it's just impossible to change this. We have to change. We have to change our approach.
Right.
And,
Exactly.
and maybe we incorporate, maybe for some, it is no Western medicine. It's all holistic. And maybe for
Hmm.
some,
Hmm.
it's the combination of both. Who knows? Everybody's different. But I would love to see more physicians incorporate holistic modalities into their
Yeah.
treatment plans. But I also don't know that they get a whole lot of that education when they're going through med school.
Well, no, they don't. They get like how many hours of nutrition, maybe, or only a couple hours of
Yeah.
nutrition. Listen, when I left, and I did my holistic nutrition certification. It was like a 18-month certification. I had to unlearn Western medicine and I relearned traditional Chinese medicine and how
Mm-hmm.
you can put foods to traditional Chinese medicine is, in my opinion, and Ayurvedic medicine are the two most preventative types of lifestyles. And I think that the most, or the more that doctors, to your point, nurse practitioners, nurses learn these things, because I've already worked with a lot of doctors, taught them a lot of different modalities, and even nurses. I'm getting cold chills because this is where I can start to see the change, and it's going to take a
Mm-hmm.
grassroots, in my opinion, little, grassroots movements of people like me that, and you, that were like, hey, peace out, we're learning things differently here, and we start educating them in this way, and then they start to, because there's lots of functional medicine nurses, nurse practitioners, doctors around me anyway, and I'm in
Mm-hmm.
South
Yeah,
Carolina
same
where
here.
you know and so I'm really, really hopeful, because even introducing things like breath work, that can change so much. Um, Even just like a meditative or like a reflective or prayer time, doing these kinds of things for your spirit, right, will affect your
Mm-hmm.
body, and how we learn to eat better. And so I do, like, even as we're saying, like, I have so much energy right now just kind of rising into my heart, that I really do have this hope for where it's going. And I think it's just
Mm-hmm.
time for us to get loud, and it's time, I hope people listen to this, to your podcast, and really hear how people are committed to change. We are
Yeah,
committed
I
to
hope so
change.
too. And there's a lot of us out there that are, I'm learning about this, giant network of people from nurses to
Good.
doctors, holistic practitioners, so many people that are trying to take part of this movement. It's huge.
Mhm. It
And I'm
is
proud to be
huge.
part of it.
Me
I
too.
love
I am
it.
so proud. Me too. I'm like, hell yes. And so
And you're,
to look back and go, I left this 14 years ago because I saw then, I feel so
Mhm.
fucking validated. Excuse my language. I
No,
do.
good for good.
I feel so fucking validated that I'm like, you know what? I saw this and I'm not crazy, because I thought, I mean, this will make you like, people project
Uh-huh.
all over you and you believe them, and it's like, you're crazy, Andrea. No, this is what God put on my heart. And I know that when that happens, I have to move. Like, I have to
Mm-hmm.
do the thing. And I'm not a really religious person. I'm just saying, like, I have that connection, and
You
when
feel it.
spirit
Yeah.
moves,
You know you're
I feel my spirit move. Yeah.
Yeah, yeah, yeah.
And
Well, you
so,
are doing something. I mean, to your point, like coming out, I mean, we're all indoctrinated. We're all indoctrinated brains, and
totally.
the first thing
Yeah,
we have to do is unlearn, and that's difficult, and that make in itself makes you feel
it
crazy
is.
because you're like, you know what I mean? So, um, helping nurses and anybody in the healthcare system, like helping them through that transition
Yeah.
and helping to educate them, because I know I'm not alone in this. I mean, I feel like a complete idiot so many times, especially when I'm talking to patients who have been injured by the system and who have
Mm.
learned. They've really dug in deep and learned about their bodies and,
Right?
learned about these different options out there. And they're so smart and
I
like they
know.
know what they're talking about. And oftentimes I don't, I'm just like, well, isn't there a prescription for that? Like it makes you feel so
You're
dumb.
so funny.
But that's what we need to do is educate ourselves.
Well, and
And that's
here's some
probably
of
the
the,
hardest part.
I agree with that. And also, I'm going to quote unquote, when you go in, because I've done this as a patient, and I'm like, Andrea, stop telling them that you're a nurse. Like, just don't
Mm,
even. Or if you go in and let's say I was just somebody that wasn't a nurse, I didn't have any medical background, but I'd done my research, and I walk into the doctor and I'm like, I really think I have POTS, or I really think, I've been down the rabbit hole, I've been doing my research on this, and I really think that I have hormonal imbalance. And you can't say that because of the
mm-hmm.
ego that's there.
Mm-hmm.
And they're like, well, who are you to tell me? I am God and I know better than
Yes.
you.
Ego.
And it's
Mm-hmm.
like, what? Like, we have got to take ego out of this. It's okay to be wrong. Like, this person knows their body better than anybody else. They live with themselves 24/7, and take that out of healthcare.
Yes.
I have a lot of
Well, and
opinions
I
on all
honestly,
this.
oh, no, I do too, and I want you to share
Yeah.
them. I think it goes back, that ego goes back to them, it's not, they didn't learn it. It wasn't a part of their programming, and
Yeah.
so they feel stupid. How
Yeah,
does this
they do.
patient know this information? I don't. I think that's a lot of it. I think that's a lot where a lot of the gaslighting comes from.
Yeah. Yeah. You're
So,
right. I can see that. I know
yeah.
that's been my mom's experience. And I would go to the doctor with her to be her advocate, and her doctor, well, before he decided to retire, that is, would totally just like get really prickly, when I was trying to tell him like,
Mm.
"Hey, have you thought about this? Have you thought about this?" And now he asks her. He asks her like
Oh,
medical questions, and I'm like, "Interesting. Isn't this interesting?" And I
that's
love
a
it, and I
wonderful
respect him.
turnaround.
I respect him so much for that. I really do.
Yeah.
And so, yeah.
Yeah, doctors who are willing to say, I don't know, or um, let me, what do you think? Or who are just willing to hear patients who, maybe have done some research. I think that's huge. There was that big, no WebMD movement for a long time. You didn't even want to entertain patients who came in, walked in the door and said, "Well, I did some research online." It was like they were automatically dismissed. I think that's changing. So there's so much to talk about, healthcare in general. So
Yeah, there's a
I
lot
mean,
to unpack. Yeah.
yes, there is a lot to unpack. I mean, these were
Hmm.
honestly meant to be like 30-minute episodes. They're like hours, some of them. One was almost 3 hours,
I mean, because
because
there's
there's
so
just so
much to
much.
unpack. I mean, yeah, and with
Yes.
everybody's experiences, but there's got to be. I'll be curious to see like the through line though of this, like all of these conversations, like really taking the through line of
Yeah.
what the root cause is, if there's just one, because I'm sure there's not. It's a
Hmm.
system. I think where we were too was talking about like pharmaceutical companies, and because they need to get out of lobbyists need to get out of the White House.
Yeah.
Yeah.
Well, yeah, that, and I mean, so I actually, when I was talking to Dr. Layla, she did not agree with this, but from what I have read, and honestly, I think you can do like a Google search, that there is a large percentage of the medical school curriculum that is funded by Big Pharma. And so that's where it starts. Now, if I recall, I'm not sure she did at least all of her medical school in the US, so that could be why she didn't see it quite as much. But if that's the case, I mean, it's obviously like we're watching the result. This is the direct
Oh,
result.
this is the direct result. And talking about medicine and going back even to when it turned petroleum based medicine,
Rockefeller.
the Rockefellers, right? And
It's another rabbit hole.
so, I know, and this is when I did my holistic nutrition study. He was a naturopath and an MD who I was learning from, and he had all kinds of information about all of this, and that's again when my eyes were even more open to marketing ploys and the deceptive marketing, and actually I became a copywriter and saw it immediately too. I was like, the
Oh,
deceptive marketing tactics, yeah, in health. Like they're running ads for medicines now, like
isn't that
and
wild?
yeah, it is.
Brought to you by Pfizer. Brought to you by Pfizer. Brought
Yeah.
to you by Pfizer. Um, and the fact that they,
Mm.
carry no liability essentially. Again, like you can't sue them. So
How can that
I know, isn't
be?
that crazy? That was
How
Reagan,
can
I
that
think.
be?
I know.
It may have been.
Yeah, I
You're
think it
right.
was. I can't remember the specific law. Um, Somebody might remember it in the chat, but yeah, I mean, you can't. Which again, it's like it goes back to these poor doctors that carry carry the brunt, because they're the faces.
Mhm.
They carry the majority of the liability. Like I had a friend of mine
That is
who
true.
went through med school, and worked for about a year and ended up leaving because the malpractice insurance, it was astronomical. And between that
Wow.
and his medical, his school loan debt he's just like, it's just not, I'm never going to get out of this.
Well, that right there tells you if you have to have that much malpractice insurance,
Right.
like let's start. I'll tell you one thing that I loved about nursing school is that it taught me how to critically think.
Mm.
Because I didn't learn that in high school or junior high. I may do myself here. But this, but we weren't taught to critically think, and
Yeah.
we now that we are taught to critically think, like I really wish there was something out there to help everyday people just that didn't have to go through nursing school anyway to really
Yeah.
critically think, and to question things that don't feel right to them.
Hmm. Yeah. I agree.
Because in what world, again, do we live in that it's okay for doctors to not understand nutrition and not to understand how to treat somebody effectively as a whole person,
Hmm.
and like how it all plays into, like I said, we're all fragmented because it's like, here, go to this endocrinologist. Oh, here, go to this rheumatologist. Here, go to this GI specialist. And none of them talk to each other. And, you know,
Yep.
unless they read the notes that are in Epic, but they're not reading each other's
Well,
notes.
because and how do they have time to do it? You know,
Well,
and
they don't even know how to access it. They don't even know how
that
to find the other
that
notes.
too. Yep. No, that too. I agree.
I know.
I worked for a specialist, an ENT guy, which he was a wonderful doctor. I'll give him that. I mean, he really
Yeah.
cared, but he would see upwards of 80 to 90 patients a day.
A
How
day?
a day? How in the world? And I could not believe it. Like when the staff first told me that when I first started working for him, I was like, that's not possible. They're exaggerating. No, I mean there were
That
days that he saw. I think that the highest I saw was like 92. 60 was a slow day. But how in the world do you efficiently and effectively
you don't.
treat a patient in
You
a
don't.
60-second time slot?
You don't.
It's just not
And that
possible.
feels so negligent. That is so
Yes,
negligent. And
yes,
there's so much negligence happening in
yes.
in the healthcare. I mean, yes, there is
Very
a lot of
negligent.
negligence.
Yes. And even though he meant
Hmm.
well and tried to do well,
Right?
yeah, that was
Because
yeah, negligence is
to
the
your
perfect word.
point, yeah, you keep bringing me back because to your point, like it doesn't mean they're bad people, honestly, because there are some really good doctors and that
Yeah.
really, really care and
Hmm.
feel so torn. Like their hearts are breaking too. I think at this point, a lot of doctors that I've talked to anyway
Oh, I
are
think
like,
so
I
too.
can't do my job. I can't do my job because of number one, AI in the medical field, especially in insurance.
Hmm.
And it's very frustrating to them. Like I just had this conversation with my PA last week and she was almost in tears and I was like coaching her and I was there to see her about my diabetes.
Oh,
And so I was like, just, I see you and I see that you care. And she does deeply. And I could tell it was just tearing her apart. But the AI thing too, not allowing them to do their job, is just like, what world do we live in that this is okay?
yeah.
It's not okay.
Well, I've learned recently that there's a pretty significant increase in the amount of I have to be careful what I say because of having TikTok on, but this of self unaliving amongst doctors in the last few
Oh,
years.
yeah.
So you know that's
Hmm.
sad. I don't even know what it looks like for nurses. I'm sure it's up there as well. Um,
I would wonder that number too. I really do wonder that number now
yeah,
that you bring that up because we've been talking about how nurses are addicts. Some of them are addicts now, and that goes together with the depression and that suicidal ideations and actually doing it. And
yeah.
so it. This is trauma. This is why everybody needs shadow work. I'm
I
very biased
yes.
at this point around that.
Well, no, you're
You
right.
know.
They do. There's not enough. knowledge out there about it, to be honest. Like I said, I had no
There's
idea
not.
what it was. I ended up doing
Yeah,
brain
yeah.
spotting treatment. It changed my life.
Oh, so
I would
good.
love to see everybody take part in that. But it's not, preventative care. There's not enough emphasis around preventative care, holistic
There's
care,
not.
and there and
And
even like
holistic, I see, is very preventative,
yeah, I do
Yeah.
too. That we were talking about Rockefeller and petroleum based.
Mm-hmm.
That's when things really started to change. I did not know about the Flexner report until just a few years ago. I had no idea.
Wait. I don't even know this. What did you just say?
Girl.
Oh, tell me. I'm like, oh my
So
God. See, I know. I'm like,
the
I don't know
Flexner,
everything.
yeah, the Flexner report. This is a good rabbit hole to go down. So when
Okay.
Rockefeller introduced the petroleum-based pharmaceuticals, he hired a contractor. And I don't believe that the contractor had any sort of medical background, but he hired this contractor to create a report. And that report basically demolished anything holistic. That's when everything came about that like holistic care was bad, or holistic modalities were bad. That's when things became like heavily regulated. That's when it led to like the medical school curriculum all kind of being under one umbrella. It was one, this is how you're going to do things. But in that report, it really, I'm trying to think of the right word, dismissed holistic modalities and remedies, and look into it. It's a very
Like
interesting,
herbals, like
yes,
in like herbal medicine,
correct,
because herbal medicine is like the medicine, and
yes,
that's my opinion. Like,
yep,
I take herbals every day. Like, that's why I
I do
study
too.
herbalism. I mean, that I'm telling you, no. Okay, I'll definitely go look that
Yeah.
up.
I
Thank you
did a
for
video
sharing
on it a
that.
couple years ago. I think I have it pinned still, but it is, it was a good rabbit hole to go down. And it really shed light on, oh, this is how we got here. This is why the herbalists have been demonized. This is, it was all a
Oh
ploy. It
yeah,
was all a
they
marketing
have been
tactic.
demonized.
Yep. Big
That's what I'm
time.
talking about. I think a little bit with the marketing, but even now, like something labeled natural versus natural. Okay, well, what does that mean?
Yeah.
And people are thinking it's good for you, and it's not necessarily good
I
for you.
know you do have to be
Um,
careful.
I, oh yeah, you do have to be careful. You have to know, right? If you really want to take control of your health, you have to get educated. You
Hmm.
have to take self responsibility. There's a lot of this, and some people don't want to hear this. It's just like everything else in life. Like we have to take responsibility, and we need patient advocates out there. And so I know when we first got on, you were talking on TikTok with a doctor that had become a patient advocate, and
Yes.
immediately I'm like, yes, like yes,
Yes.
that's what we need.
Yep.
And so
Agreed. We need more of that. Yeah,
yeah, I
she's
always tell
great.
people, yeah, if they're going into the hospital or anything like that, because I just lost my dad actually
Oh,
about
sorry.
10, 11 months ago, to kidney cancer. And there's no way I was not letting him go into the hospital or to the doctor by himself. I would go to every appointment. I was there. I stayed with him, overnight when he had his nephrectomy. And I don't trust. I don't trust.
Yeah, I don't blame you.
Unfortunately, I don't
Actually,
trust.
I did a couple. I think I did the same video a couple times, but I put a video out there at one point and just said, "Hey, listen, in after 25 years, the best advice I can give somebody is do not ever go into a hospital alone and do not ever let a family
Hmm.
member stay alone for an extended period of time." And I didn't realize at the time like
Agree.
how scary that probably sounded to a lot of people, because the
Hmm.
first time it really blew up, and they're like, "Why? Tell us why? Tell us why?" And I'm like, "Well, isn't it obvious? I mean, like." That's when I really, kind of had this awakening to the fact that, man, the general public really doesn't understand how bad the industry is, you know? Um,
I know. I know. Every question that you ask me, I'm like, I want to know your like
yeah.
too. But yeah, yeah. What
Oh, yeah.
was your? But you're right. I mean, this has been such a great conversation. Like,
Yes, it has. It has.
there's so much more to be said.
I know. I know. I can't possibly get, we can't possibly get everything so I'll have to have you on again because we cannot possibly get everything in one sitting. I do want to ask
Right.
you
Yeah.
a couple more questions if you don't mind.
Yeah.
I won't take up too much more of your time, but I think you mentioned at one point, was it your mom that worked for a research company or something, or
My
in a
stepmom.
your
Yeah, my stepmom.
stepmom? Yeah, can you expand on that
Hmm.
a little bit? Like what I think you
Yeah,
mentioned
that
something
didn't last
about.
long.
Okay.
So she got this job, because she wanted to get out of the hospital. Everybody wants to get out of the hospital because it's so bad. And so she took this research job, and I think she was only there for like 9 months because she started to see how they fudged the numbers and made things like look better for the medication that they were researching, as opposed to like the harmful effects that it was doing for, or the potentials that were there to harm somebody. And she was, I mean, out of like, just, what's the word I'm looking for? Like, how can you live right and be a part of that and not go home and feel guilty for something that may ultimately end somebody's life? Like, anyway, so that didn't last long. Her eyes were open there, and that was very early on, even in my nursing career too. So I knew, I mean, I knew, all this BS is happening around you, and still you stay.
Well, yeah, but and something like that is confirmation, because you like know, but you don't. You question it, like really,
You do,
you
right?
know what I mean?
Yeah,
Like really, like they
yeah.
can't be putting money over patients'
Well,
lives. That can't be
right.
happening.
Like you don't want to believe it.
Yeah, it's hard to believe, but then
Yeah, you
again,
don't
like
want to
you
believe
hear
it.
stuff like this, and well, it's confirmation. I mean, I always knew. I mean, just like polls, like numbers are very easily be skewed. And good for her if she saw that happening and said I can't be part of that and left. Good for her. Kudos to her. That's not easy to do.
Yeah, it's true. It's true.
So, and then how are
I
you
felt.
now with your diabetes or like any other health issues? Like, do you find yourself incorporating holistic modalities as well as
Oh
utilizing Western med?
yes. Now this is okay. So all I see now basically is my endocrinologist, and I see functional medicine doctors. I have had to come out of pocket this whole year with my health care because I couldn't get any help. And so I have been gaslit and gaslit and gaslit about my thyroid, about my adrenals, about everything that is going on with my autoimmunity. And so I have been going to finally a functional medicine doctor or nurse practitioner. She gave me progesterone. Doctors had no idea what to do with me as far as hormones. Like, I just went and talked to my nurse practitioner. I was like, I think I need estrogen. She's like, oh, you want some estrogen? Okay, here, I'll write you a prescription. Didn't do any labs, and there again, I went along with it. And I'm just like, but I remember thinking, why did she not do labs? And so I was totally convinced, though, because we are our own worst enemies sometimes. And ended up, I did a salivary test through a holistic doctor, and it revealed, voila, I am insulin resistant and I am estrogen dominant on top
Oh,
of all of this. Oh yeah. And so she gave me progesterone, some compounded progesterone. And I will say, oh my God, I hope that this gets into healthcare somehow. But I've been doing NAD infusions. I can't remember what
okay.
NAD. I can't remember what NAD stands for. I know it's the precursor to like NAC, right?
Okay. Yep.
N-acetylcysteine. And our bodies quit making this NAD as we age. Well, I started going down the rabbit hole with NAD because my mom had a ciprofloxacin reaction from
Okay.
Cipro, and it messed up her fascia and her muscles and her tissues. And she had seen a holistic doctor. She ended up having to go to one too, and they were like, "Okay, you need NAD infusions." And so she did maybe 4, and she couldn't move her shoulder. Well, now she's like, oh, I can move my shoulder. And so I started doing it because I couldn't move my elbow, and I had, like, literally, I told my partner, I said, my life force energy is draining. Like, I feel like I'm dying. And that's because the lack of I think women's wellness and the lack of understanding our hormones. We did not even come into being studied, women in healthcare, until the late 80s, early 90s.
Yeah, isn't that crazy?
They were doing all of these tests on men. FYI, physiology between men and women, way different. And so they don't know our bodies. And so life changing to get on the progesterone and do the NAD infusions, because NAD infusions, I'm telling you right now, they rebuild your mitochondria, literally.
NAD
and I can
infusions.
feel it in my system.
Interesting.
Like I can feel it. I feel so good. And for me to say that, to come from, like, if you would have asked me 3 months ago, I would have told you I'm literally probably, I'm not going to be here long. Yeah. I was just feeling so bad.
Wow. I mean, I've done like vitamin
it's expensive.
infusions. I'm sure. That's what. Well, that was going to be my next question. So, is it like I do vitamin infusions, and I don't carry insurance anymore anyway.
Yeah.
I mean, I do everything out of pocket. So, but I do vitamin infusions, and like I'll feel, it's probably all, it's like I might feel energized for a couple days, but that's. I mean, I think that you're probably peeing most of it out
this
anyway.
is different.
I was going to say, is that NAD?
Yeah, no. All those B vitamins.
Right, yeah.
Yeah. NAD is like, it's kind of uncomfortable getting these infusions because of what it makes you feel tight in the chest, and like my stomach gets a little crampy sometimes, or you might get a headache. But it is literally rebuilding your, regenerating your mitochondria.
Okay.
And so the mitochondria are starting to fire again. I couldn't move my elbow for like 6 months. And I had that first treatment, and I was like,
that is so cool.
I mean, it's just, I know. Oh, listen, I have gone down the rabbit. That's me. Like, I have to go down all these rabbit holes to find the answer. And I am bound and determined to do that a lot. So, I found a couple of different places that will do NAD infusions. They're expensive. They're about, around here anyway, they're about $500 for a full dose. Okay. And it takes about 3 or 4 hours to run. So it takes time.
How often
right?
do you do them? She does NAD infusions for you guys on live. Mm-hmm. So I didn't even, I guess I didn't even realize. I've seen the NAD supplements all over, but and
I will promote those, but honestly, I question the ability for our stomach to allow that to really, because once it goes down the digestive tract, a lot of things aren't absorbed. Mm-hmm. But I have been taking it orally too, and I will share these things on my TikTok account. How often do you
do the NAD infusions?
So I went for, I had to miss a week because I run retreats for women, but I did one a week for 4 weeks. And then I skipped a couple weeks. Last week I went back and got half of a dose just to see how it would work. And so I did those 4. My plan was to do 6 and stop right there, just to see how I feel, and then to do them maybe once a month. So that's my plan moving forward, is to do one once a month. Just because of my type 1 diabetes, and I know that it's regenerative, and I have so much energy. It's like I can't.
Wow.
There's no way that I could convey to you how much this has changed my life.
That's so cool.
I know, and I'm like, oh my! And I was telling Sandra, the nurse practitioner that I'm working with this, I was like, Sandra, like, this is what needs to be available for people with chronic illnesses, because that's really who they market it to, and that's really who it's for. In my opinion, it's best for people with chronic conditions. And so I was just crying. I was like, this is exactly what we need. This is what I've needed, because it works. And yet I doubt that it will ever. No, I shouldn't put that out into the universe. Who knows? Maybe it will one day be covered. Yeah. I don't know. But she wasn't very hopeful for it.
Well, I mean, honestly, I wish that more people would just, and I know not everybody can, especially when you have no choice but to utilize the system continually. But we've all been so scared to not carry health insurance, but if you don't and you put that money aside, you have it if you do need something, or you can, self-pay for things like that too. I mean, my gosh, like I think $500 an injection, I was paying more than that for a health insurance plan each month. And I think, I mean,
Great point.
most doctors I've come across are willing to work with self-pay because they'd rather not deal with the insurance. Like they'll work on
I,
prices with you.
you valid,
Yeah.
valid. And did you know, like I went and had labs drawn at this like little lab place, and it was only like $5 to do a thyroid panel. And but if you go to the doctor and you're using your insurance, it's hundreds and hundreds of dollars, and you're paying your copay. But with type 1 diabetes, I'm a little scared to just go because of my insulin supplies and my insulin
Yeah.
to go without insurance. But damn, you have a good point.
Well, yeah,
I mean, solid.
yeah, no, well, and again, for somebody that's got, that has to purchase insulin or, that has to purchase medications or see a doctor for chronic issues, like I get it. For somebody who's,
Yeah.
generally has no health issues, it sees a provider minimally, I think it's a smart move. And I know,
do too.
from a business perspective, I learned a lot about medical billing when I was in my last role, and every doctor has system, whether it's a hospital or doctor's office, whatever, they have contracts with each insurance company, and so they set their prices high because number one, I mean, they're never reimbursed what they are contracted to be reimbursed. That never happens. It's always a fight for them to get their money. And so
Yep,
they set it
it
high
is.
because there's going to be that one insurance company out there who's going to be willing to pay it. But then there's usually a separate self-pay rate. I mean, that's
There is.
what I've come across. So,
Yeah. And so to your point, I mean, maybe, I don't know, if I were healthy, like didn't have a chronic illness, yeah, I could see me not having insurance.
yeah.
And just going and getting those infusions, and because that's prevention, I'm telling you.
Yeah.
And making sure that I was eating correctly. I know. I tell
I'm
everybody
looking
about
into
NAD.
that. NAD
I'm like,
infusions.
go do the NAD. I'm like, I wish, like, if I had a nurse practitioner, I would have my own IV hydration clinic myself here and do all the healing modalities I do, including the shadow work, and I do it in my home office, but not IVs,
Yeah.
obviously, because I'm just a nurse. I'm not a nurse practitioner, but that would definitely be
But
part
it
of
depends
my
on your state, right?
plan.
I thought I just spoke with an RN not that long ago. I don't know what state she was in, but she runs an IV infusion clinic, and it's just
Yeah,
her.
every state is
Yeah.
different. I know there is, and I have a friend in Asheville, North Carolina. I'm just an hour out of Asheville. That she finally got to reopen after Helene, but she is an RN, and she has a nurse practitioner working with them, and then they do have like a medical director that oversees all of the documentation and things like that. For people. So, but in South Carolina, no, they made it hard for us, so I can't do that. Yeah, I know it sucks.
Okay.
But I
Well, is there
would.
anything else that you want to talk about or get out there to people?
Well, I think, and I am very biased, and this is where I just have landed, like I said in the beginning, is really taking care of I think your emotional wellness goes right along with your physical wellness and your spirit wellness too. I really do. And no matter what your beliefs are, religiously or not, I'm, like I said, I'm not a religious person, but your spirituality and your spirit matters. And I wish everybody in the world would do shadow work just to see where they're telling themselves some stories and learn to take up for themselves, draw boundaries, have that voice that they need to take care of themselves, especially when we're talking about the healthcare system. And so that they feel free. And I'm not talking about being aggressive. I'm talking about just being assertive and asking great questions, and to know how to do that for yourself and to navigate all of this. I really do wish, and that people would alchemize their trauma, right? Everybody, nurses, doctors, everybody in the healthcare field, but everybody who also wants to practice prevention, because stress, we know intellectually that kills, right?
Yes.
Stress kills, like we know this, right? But we don't understand at the same time that when we live in fight or flight day in and day out, that is trauma. That is trauma. Your body perceives that as trauma. And trauma can create depression and all these other things. This is, I could talk about shadow work forever. And in starting my own podcast, that's what I will be
Oh,
talking
that's
about
awesome.
a lot is this. Yeah. Because we all need this work. If you're a human walking this earth right now, you need that. Just to, like, how do I want to say this? Like, really, it's alchemizing like your inner world, like what's going on here, and then really practicing, like looking into herbals. And you have to be careful, especially if you are on medication like Coumadin. And I mean, there's a multitude of medications that could have like drug herb reactions. But I do think that, to your point, what you said earlier was, herbalism being like the first line of defense, for people to live a healthier life. And so I think all of that goes together. And that's where I am in this dogfight. I don't know if we call it that. I hate to look at it that way. But in this system, yeah, that's where I've landed. And I'm a nurse, but I always tell people I'm a nurse in a whole different way. And I am just so damn proud of myself for carrying the torch 14 years ago, 15 years ago. That was scary. And I did it.
Yep, I know, and I'm sure it was. And I commend you for doing what you did and leaving, and for doing what you're doing now.
Thank
Of
you.
course, yeah. I mean, again, I'll just put in a quick plug for, the importance of working through your traumatic issues. You may not even realize that you carry them.
I know.
That's the thing. And I will say, when I came out of healthcare, I was so sick physically. And
Yeah.
I mean, to the point where I was chronically throwing up. I mean, I was really sick. I was losing a lot of weight. I was on
Yeah.
half a dozen prescription medications. And I just so happened to find somebody on TikTok. She goes by the spiritual shrink, I think, or something to that effect.
Oh,
Anyway,
I love that.
yeah, so
Yeah.
I learned about brain spotting treatment and shadow work. And I had blocked out about a 10-year period of my childhood, and I didn't know why.
Yeah.
And in doing this
Yeah.
brain spotting, I learned why. And it was really hard to relive some of those things.
It is. Let's
But it
not, I don't,
very
it
hard,
is.
but it changed my life. My physical
Do you not
symptoms
experience,
disappeared. Everything disappeared. I got off of my prescription medications. My physical health went, I mean, I cannot stress the importance and how life-changing that was for me. So I agree. I think it's wonderful that you're helping people walk through that, because it is. It
yeah.
is. I see so many people, and especially online, but even in person, that are struggling, and if they would just do that work,
Face it.
yeah, just face it
it.
head on.
Right. Because,
Yep.
right. There's this, people call it, people ask me, like, what is shadow work? And I'm like, well, it's bringing things that are in the subconscious to the conscious. Right. And like you said, you may not even know that you have, I didn't know I was still carrying inappropriate guilt from my nursing career. I didn't know. I didn't know that when I was 7 years old, some things happened to me that created stories that made me make decisions based on that. So you're 1000% right. And this is prevention.
Yeah.
Right. This is how I practice prevention. And so, yeah, thank you. I appreciate you sharing your story too around shadow work, because
Of
it's not
course.
easy.
Yeah,
A lot
no,
of
but
it isn't
but it's
easy.
important to get out there. I think we could all benefit from it. So,
Yeah.
where can people find you on social
Thank you.
media?
On social media, so I have two TikTok accounts. One is called The Beauty Way, and I talk more about the shadow work here. And that account hasn't really, I don't get on there that much because I do my TikTok shop. It's Inner Alchemy Nurse. And then on my website, AndreaArledge.com.
So, Inner
Yeah, if anybody
Alchemy
wants to
work on
nurse,
TikTok. Inner Alchemy Nurse
nurse.
on TikTok. And then she has a
Yeah.
website. And what's the website again?
It's my name. It's AndreaArledge.com.
AndreaArledge.com. And
Yeah.
we'll do, when Mark does the editing, he'll put your TikTok handle, at where your name is too, so people will be able to find you.
Awesome.
Okay. Well, I really appreciate
What a
you
great
taking time
talk.
today. Yeah, this was excellent. I'd love to have you on again. And
Absolutely.
yeah, anything else before we
We can
wrap
go
up?
down the rabbit hole.
Yes, lots of them. We can like choose, a rabbit hole per episode.
Which one today?
Because really, I mean, you could spend hours on each one.
Oh, you could.
Yeah.
You're absolutely
Yeah.
right. And I appreciate you. I just want to tell you too, like, I appreciate you having me, but also I appreciate what you're doing. I found you on TikTok right when you got on TikTok. I've never told you this, because I remember you had just, I think you had just, I mean, this was like, what, 4 or 5 years ago.
Yeah.
Your hair was a little bit blonder. I remember you're sitting on the front porch of your house, and like I was like, oh my God, I knew right then this. I just have chills saying that. It was like I knew right then your message was going to go wide, and so I've watched you, and I really appreciate for the world. I just want to thank you what you're doing. I really hope you realize the importance of what you're doing. Yeah.
I really appreciate you saying that. I lost my oomph for it for a while. But
Yeah.
then, just because again, it was so hard to get back there mentally, but I do feel like this is my purpose. I feel
But is
that-
this not like a reparative
Yeah.
experience around
Yes.
it?
Oh,
And that's what it's
very.
shadow work. This is what we talk about. Like you need a reparative experience around
You
your trauma.
do.
This is the reparative experience for you. I just want to point that out because I really believe that for you. I believe that for all of us that are able to have a voice about this. So
Yeah, that makes total sense.
I just wanna hug you.
Oh, I want to hug you. I never looked at it that way, so that makes sense. But I do feel, I mean, something kept tugging at me and was like, you've got to do this. You've got to do this. You have to do this, So it was something I never could let go. So I do feel like I may not change the world, but I'm going to make some sort of change. And so
I absolutely
yeah,
believe that.
yeah. So
it's right. It's right. Things don't get laid on our hearts for no reason.
Correct.
And like I got this tug, and I can't not
Yes.
do it.
Yes.
This is your purpose.
Aw.
Oh, chills, girl.
Well,
It's
thank
called
you.
Soul shivers.
I appreciate you saying that, and I appreciate your support. And again, I'd love to have you on again sometime.